Hey, everybody, Saul Marquez with the Outcomes Rocket. I want to welcome you back to our podcast. Today, I have the privilege of hosting the amazing Jed Rudd. He serves as Chief Operations Officer for Tribal Health, a staffing and leadership company for tribal healthcare facilities. With more than a decade of healthcare operations experience, Jed brings expertise in advanced approaches to healthcare execution, operational excellence, and leadership performance. I'm so excited to have him here and tell us about his story and the amazing work that Tribal Health is up to. So, Jed, thanks so much for joining me.
Saul, thanks for having me. Excited to be here.
Hey, you know what? Excited to have you here. I know, well, you started your career as an occupational therapist. Tell us about that. What is it that got you into healthcare?
Absolutely. I started out actually in life as a theater kid, musician, film buff, like creative. And as I started to work my way through my first degree, I realized I probably wanted to leverage my analytical mind and pursue something maybe in the healthcare sphere. And when I was exploring different kind of postgraduate healthcare opportunities, occupational therapy seemed to really blend that creative component with the science. So I jumped into there and it was great and I loved it. And as I started practicing, I was looking at, the people 20 years my senior that were magical. They would touch people and heal them with, their intent. And I was trying to figure out how you do that. And
Yeah.
as I was setting that intent to study and become a better clinician, I was looking up at the same time at the healthcare leadership around me. And I just wasn't seeing the same level of engagement that I saw clinicians. And so I thought, well, if I put like half of that effort that I would do as a clinician into trying to be a good leader, maybe I might make an even bigger difference. And that propelled me in this kind of interesting journey of trying to become a better healthcare leader with that clinical foundation to kind of lean upon.
And you know what, Jed? You had that instinct, that sort of internal compass, so to speak, like just telling you, right? Like, this is great, but maybe there's something else out there. And that's a true inspiration for anybody listening out there, that you might be doing something that is maybe not hitting home for you. Just kind of trust your gut, and Jed's a great like example of that. Now he's, been a senior leader at several healthcare facilities, now Tribal Health as the chief operations officer. Trust your gut, right? I mean, like, there's an opportunity out there for you.
Yeah, and be prepared for for things to get a little bit hard before they get better, and be comfortable with that's your journey. And I really, it's propelled me places that I never thought I would be. And the outcome, here we are, man. This is super cool.
So cool.
Now we're with
I
Tribal
love
Health.
it. I
Yeah,
love it. And so I want to give you an opportunity to talk about what you guys do there. How does the company add value to the healthcare ecosystem?
absolutely. So one of the dirty secrets in healthcare is that usually the areas that need the highest level of care end up with some of the less qualified individuals providing care out there. That's just who is attracted or who can get a job sometimes out in these areas. And so we end up underserving these communities that have most need. At Tribal Health, we really try to flip that script, and as opposed to trying to get a warm body to go into these areas of service, we appeal to those people who were called to the service of medicine and that mission to begin with. We like to say, like, we're like doctors without borders with a paycheck, and you can live in the US while you do it. When people start to serve in our indigenous communities, it's shocking and inspiring. And the level of care at which you get to practice really calls to what most people are drawn to medicine in the first place. And they usually lose it, as part of the journey in corporate medicine. So I think that's what's super inspiring, is that we attract a certain type of physician, and then the ways in which we're partnering with tribal communities with our great intent to not be the savior. We don't have this figured out. We are here to listen. We are here to partner, and ultimately serve. Right? And sometimes a lot of people in the staffing space, they have a little bit more of a churn and burn. You have an opening, we'll fill it mentality. And we can do that. That's in our skill set. And at times that's appropriate. But our preferred method and where we see the greatest success is true partnership, where we manage a certain section of practice in collaboration with the tribes or with the federal institutions. and work on the quality and the overall systems of care. And that's when we see that force multiplier, is when we start to collaborate together. The overall patient experience improves, wait times improve, throughput, all the stuff you want to see. And of course, that then draws in more patients into the systems of care that were previously not as high quality. And there's just a kind of a positive cycle where people are getting the care they need closer to home. And also, our clinicians are having this meaningful experience in places of need across our country.
Do people tend to like the clinicians that serve, do they tend to stay in a particular area for a while, or are there rotations? Like, what are you seeing in that regard?
Both, both. We
Both?
do
Okay.
find that clinicians are drawn to certain facilities for sure. They find their people and the communities
Yeah.
that they serve, and then they become the unit. And that's where some of our hospitals that we serve with, the unit of providers, people will go there for the first time and they're like, "This is the most amazing medical team I've ever served with." And
That's
yes, you
awesome.
are technically, in this travel practice management space, you're living at home and you're traveling in and out, but you're working on this really highly skilled team, as opposed to being a lone warrior in, just some random facility. Not to speak poorly about that, but just it's a different experience. And that tends to resonate with people who maybe they're not comfortable stepping into a travel assignment or into the field of locums. There's a little hesitancy, and then they see that there's actually a community of support, and we try to do things differently from a support standpoint too, as opposed to just sending people out. We try and ensure people are culturally competent and they're supported. It's not like you can just apply the same skills that you would apply in the hospital you're at or health system you work in
Yeah.
and succeed in the tribal community. We help give you the tools and then ongoing support with clinical leadership, medical directorship. You can call people 24/7 as you start to face these real clinical challenges. And there are people here on our side that help to actually talk with you, and their doctors, their nurses, our chief medical officer and our chief nursing officer, as well as our medical directors and site supervisors. Um, that's not the typical thing travel companies or practice management companies always do, is have that kind of robust support network. But our goal is ultimately to achieve that transformational generational change in our tribal communities in partnership, obviously, with those communities.
Yes.
And so with that long vision and play, we invest in those additional resources.
Gosh, you already highlighted many ways that you guys are unique and the way that you get to market. Um, Tell us about some of the things that maybe haven't worked as well and a key learning that has come out of that.
Oh man. So I was reflecting, I've reflected on that, my failures. And I think about that quote from Mike Tyson: everyone has a great plan until they get punched in the face. And
I love that
that's,
one.
yeah, it's like it's a theme in my life that I tend to have I'm a planner.
Yeah.
I get things put in place and I think I'm so smart, and life comes along and punches me in the face pretty
Oh
often.
man.
And so some of my greatest failures have been in my brilliant plans. And early on in my career, I think it was just this idea that if you have good intent, kind, hardworking, that's enough to get you through the door, right? And I learned this the hard way with a lot of the IT initiatives during the meaningful youth period, and then subsequent, and large scale, multi-million dollar initiatives that I'm leading. If you don't also balance the need for political savvy, for the rate of change, pace of change, change management with people in real time, your good intent, hard work doesn't always translate. And so in tribal communities, that's like multiplied 10x,
Oh
because those
wow. Okay.
relationships,
Yeah.
those communities are so relationship driven that if you're not extra sensitive, cautious, collaborative, humi- based in humility, that will catch you right off. So you can have the best ideas, the best systems of care. If you're not able to really understand and listen to the communities and what they need, as opposed to your genius and brilliant idea coming in from the outside, you're not going to find the success that you need to. So I think that's one of the things I really enjoyed here, is that we get to be innovative, collaborative, all the things that I feel sometimes were disincentivized on on my prior healthcare journey have been
Yeah.
highly incentivized on this side of the equation.
That trust factor is big, and you gotta keep it close, and being smart, right? Like being smart about it is also important. It's not all about good intention. You gotta be all in, be observant, And that quote by Mike Tyson, man, I love it because I too have been punched in the face a lot, but it's about getting back up, right?
Absolutely. And I think that speaks to that, if people start to really take the leadership ride, it's just getting prepared. That it's a lot of, it's this continual pursuit of self-learning. It's really this giant therapy session of a career, in my opinion, where it gets really, in order for you to be able to unlock the potential to serve, you have to get out of your own way. And if you're not working on your stuff, that's going to get in your way in your ability to serve others, and I love that the book was okay, but I love the idea of what got you here won't get you there. And so
Oh, okay.
it's a continual reflection is in what ways did what get me here? Is that now holding me back from getting to there? And as an organization, as we're seeing this, tremendous opportunity for growth, that's kind of our question is like,
Yeah.
we've been good enough, another great book we've been studying is From Startup to Grow Up. And,
Mm.
moving from the startup phase of an organization and grappling with the common travails of trying to grow and become more systematized standard without losing your soul. How do
Mm.
you do that and not become this corporate, monolith? That's not our intent. We want to keep our ability to serve with kindness and grit and hustle and do it at scale. So how do we do that? How do we dance that dance? Um, so that's kind of some things we play with. And ultimately, I love it because I have to figure that out internal. How do I Jed, me and all my
Yeah.
traumas
Yeah.
and triggers and baggage? How do I get out of my way so I can serve more fully?
Two great book recommendations too. What got you here won't get you there, and From Startup to Grow Up, right?
Oh yeah, yes.
Okay.
I
All
think
right.
that's essential. And when we read that book, I felt really positive as an operations guy, oriented guy. A
Did
lot of
you?
it's about the things that we bring in as operations, that expertise really
Oh
helps.
yeah, yeah, yeah. The SOPs, the getting everything tight, the processes,
Yeah, and aligning that around
systems.
people. And, like, that's
Yeah.
it, man. Get those people together.
Man, too good. I haven't read either of them, so I'll definitely be throwing those on my to read list, folks. Two good ones. Have you read them? Let us know in the comments. We're obviously posting these podcasts on social. And if you haven't, check out the resources page of the show notes. You'll have links there to get them. You see a lot of things, and really technology is a key factor in really, I think, influencing more rural type of care. What trends and technologies would you say are gonna change healthcare as we know it?
Yeah, that's a great question. Um, and I think I'm gonna you said one, I'm gonna throw out two because one of them
Okay,
goes
yeah, yeah, let's go.
as secure technology. The first that I'm seeing in the industry that we serve in, the staffing, practice management, consulting, quality improvement arena is the use of AI. And so artificial intelligence is going to continue to accelerate our ability to get out of the mundane and present opportunities for us to broaden our ability to serve. So it'll speed things up and present challenges and complications. The other technology that I'm seeing that will change everything is our leadership, evidence-based leadership technology. That's not something people think of as technology. As we start to adopt more conscious approaches to our leadership
Hmm,
practice based in evidence and based in what we're seeing, I think that's going to accelerate companies' ability to grow without losing their souls, for people to be able to be inspired in the workplace, not just, you know, check in, check out, which of course will improve everyone's efficiency, happiness. And that's ultimately, when I was contemplating the journey from clinician to leader, one of the key mindset shifts that I found in myself was as a clinician, I was working one on one. It was beautiful. You came in with a sore shoulder. I would help get that better and you'd move it better. That's beautiful. But when I started to work in the leadership environment, I started to see that people sometimes listen to what I said because, hey, I'm having this meeting with you. Hey, Sally, you know that thing you do where you do that thing with your eyebrows where you do this? Now I want you to shift those eyebrows like this. And I'm going to give you a metaphorical dollar, right? There's a metaphor there, right?
yeah,
You
yeah.
need to keep working here. And people would do it as a therapist. Oftentimes people would come in, I'd recommend things and they would never do it. And they would, need to keep seeing. And so I saw this really interesting power within leadership to lead, you have the opportunity to serve or the opportunity to destroy. Like you can do a
Right.
lot. Yeah, that's a lot of power. So from a healthcare perspective, when leaders step into healthier approaches, they're creating system health in our communities that sometimes we don't see. So I advocate that as a technology, in fact, that if we leverage advanced leadership practice and mindsets, tool sets, skill sets, there's going to be this ripple effect across people not wanting to go home and kick their dogs after work, looking forward to coming to work after a weekend, as opposed to being a dreary Monday. They look forward to it. They want to be called to the meeting and not left out.
And any resources you'd recommend to level up in that space, this idea of evidence-based leadership?
Absolutely. Anything like Quinn Studer, he's like the king of evidence-based leadership. Results that last was, with my Bible as an early leader, great practices based in the evidence. I think the 15 Principles of Conscious Leadership is kind of a more cutting edge. It's a slightly older book. I'm not seeing evidence that anyone's doing it in its next level in terms of its leadership practice recommendations. And then, of course, the classic oldie but goodies and stuff we can steal from other industries. High output management. This is from the tech side. But man, if we start to apply some of Andy's, ideas from this founder of Intel, known as one of the greatest managers of all time, if not the greatest manager of all time, his recommendations around leadership practice directly translate into your basic operational approach as a manager or leader in healthcare.
Folks, there you have it. Listen to this podcast, read those books. You got your MBA in leadership in healthcare. Save yourself $150K. You got it right here, packaged up with the awesome Jed Rudd. Fantastic opportunity to make sure to level up your leadership. I love this, Jed. Thank you so much for the resources you've shared today. If you want to leave everybody with a closing thought, what would that be? And then what's the best place the listeners could get in touch with you and learn more about the work that you and Tribal Health are up to?
Absolutely. Yeah. The closing thought is the importance of the dynamic between leadership and followership, right? It's oftentimes there's not enough, roles in the world for everybody to be a leader all at once. And oftentimes as leaders, we spend most of our time following. And learning to be great followers is a key skill set. And it's about supporting ideas that you think are cool and joining in when it's not super sexy to join in. When you see someone doing something great, join in. Don't sit on the sidelines and record them and live voyeuristically. Try to figure out how you can support the dance. So I would say if people hear something cool, whether it's from a service orientation, how can we serve our communities and need better? Whether it's from a leadership practice perspective, how can I be the leader I want to be in the world? Whether it's from a clinical perspective, how do I serve my patients even more effectively? When you see someone do something great, let's support each other instead of tear each other down. And obviously prepare to be greater leaders, to be able to step in when the time calls for it, which isn't as common as we think. Obviously, I love talking about this stuff. I love hearing and learning as much. I mean, Solomon and I talked, hearing your story and your inspiration. I was super interested in that. So you and your journey has been this network that you created is super inspiring. So the more that we talk and share, I think the better off we all are. If anyone's interested in connecting, I'm on LinkedIn. It's the best spot. In Tribal Health, we have pretty significant LinkedIn presence. And so we'd love to engage in a conversation with you because we'd love to learn and see what your ideas are, how we can incorporate them. And we're happy to follow others who are doing great things out in the community.
Amazing. This is so great, Jed. Thank you for an excellent message. Folks, everything that we discussed, including the books, Jed's LinkedIn profile, Tribal Health's website is going to be in the show notes. So make sure you take action. Do not stop at listening because that's how you get into the rocket. That's how you get outcomes. And Jed, I want to thank you for taking action today and being with us.
Thank you. Thank you for what you do and appreciate the opportunity. It's been fun.
My pleasure.